Anxiety disorders are those group of mental health conditions that are characterized by excessive and persistent feeling of worry and anxiety. Like we started in the last series, we've defined anxiety, and today we are going to be looking at the anxiety disorders. Welcome back to our channel. Today we are going to be continuing with the anxiety series. Anxiety disorders are a group of mental health conditions that are characterized by excessive and persistent feeling of fear, worry, and anxiety. These feelings are often followed by physical symptoms like sweating, trembling, rapid heartbeat or palpitation, like some would call it, hyperventilation, feeling of nervousness, and whatnot. So today we are looking at the different types of anxiety disorders. The first one we are going to be looking at is the generalized anxiety disorder, or GAD. So this is characterized by excessive and persistent worry about everyday life events and activities, like we mentioned in the previous video, like pressure from work or the lack of finance, you don't have money, housing problems, or any type of problem at all. Everyday situations, everyday challenges. Okay. Then another one is the panic disorders. Panic, from the word panic, fear. When you have this sudden and unexpected fear, attack of panic from nowhere, and is often accompanied by these symptoms like sweating, chest pain, trembling, hyperventilation, that is you'll be breathing rapidly. Okay. And what brings on this panic attack is something that is unknown. If you've experienced panic attack, you would notice that it just comes. You might just be doing something and out of nowhere you have this feeling like you want to pass out, something wants to happen to you, and you see yourself breathing rapidly until it calms down, the episode is over. Another one is the social anxiety, SAD. This social anxiety is characterized by an intense fear and anxiety which we often experience in public. It could be that you have a presentation or you have a lecture to present, public speaking, or when we meet new people. For instance, you are just meeting someone for the first time, and let's say you've been talking with the person on phone, and your first contact, there is this feeling of nervousness that you feel. So that's what we call social anxiety. Okay, so another one is the obsessive compulsive disorder, OCD. From the word, there's an obsession and there is this compulsion to do something. Something is compelling you to carry out an act. Is oftentimes characterized by recurring and intrusive thoughts or obsession. Intrusive thoughts are those unwanted and it's not voluntary, something that you don't will, often distressing thoughts and mental images that come to people's mind. You hear now some horrible stories that we hear of a boy going to the house and doing away with this, that, or he comes to the house and Next thing, he deals with the parents, the siblings, So these are some of the horrible stories we hear. And by the time the act is over, or whatever they did is over, they come down to tell you they don't know what compelled them, they don't know what triggered the action. So it's often accompanied by this compulsive behavior. You just picture an image, let me go to daddy's room and do this, and before you know it, you have entered the room and you've carried out the act. So there is this obsession, there is this compulsiveness, okay? At times it becomes a disorder and turns into a habit. You see, like some of these serial killers we hear, that's how it is. It just comes on to to eliminate someone, and you see them doing it. Another one is the post-traumatic stress disorder. Post-traumatic stress disorder. We can just put it like after traumatic stress disorder. This is the kind of anxiety disorder that someone has after a traumatic event. Yes, after a traumatic experience, after a horrible experience. It could be that someone was taken to a lonely place, was tortured, and was eventually released. In fact, that person is going to have recurring flashbacks and images of his or her experience in that. Or somebody was sexually assaulted, forcefully taken advantage of. Each time the person remembers the experience, it throws them into this state of anxiety. Or let's say a natural disaster, okay, probably an earthquake, or a horrible experience, or they were attacked by robbers at night and they were really tortured. So these are some of the things that leads to this type of anxiety disorder. So we are going to look at generalized anxiety disorder as a heading. The exact cause of generalized anxiety disorder is unknown, but it can be a combination of many factors, like genetic. When we say something is genetic, probably has to do with heredity. Probably one of the parents had this experience. It could be biological, your makeup, your body makeup. Because I remember then they did a lot of tests to check the thyroid function test, and to know. It could be environmental factors. It can also be triggered by significant life events like job loss, relationship problems, financial difficulties, like we mentioned some of the causes of anxiety in the previous video. So what are some of the symptoms that that one would experience if you have a generalized anxiety disorder? You have constant worry and anxiety. If you have this constant worry and anxiety, restlessness, you're not just calm, this feeling of restlessness, fatigue, difficulty concentrating, irritability, you feel angry easily, muscle tension, and sleep disturbances. So the treatment for generalized anxiety disorder can be use of antidepressants or anti-anxiety drugs. Yeah, these drugs have been designed or produced to treat either the anxiety or depression. And what they do is that they alter the level of certain chemicals in the brain. All these chemicals, they call them neurotransmitters. So they just kind of block their pathway, or kind of alter the way they act. Okay, and what they do, they help to elevate your mood, help to increase your ability to sleep and also eat. Then another treatment method is psychotherapy. Psychotherapy is like having a one-on-one discussion, you're getting a help from a therapist. This is a kind of one-on-one help where a therapist puts you through, gets some of your symptoms and helps you based on your interactions and conversations. So here is either you talk with a psychologist, to get some of these therapies. And most times they use the cognitive behavioral therapies. These are some of the therapies one can adopt, to make you have a calm mind, mindfulness based therapy. They make you what they do actually is when they talk to you, they have diverse means and method of bringing calmness to your mind, making you focus on the present, and that is it. Tell you things about life, why you don't need to worry, why you don't need to be anxious, and therapies, ways and methods to get your mind at peace and calm. So other things is lifestyle modification. Okay, this is where your diet comes in. You have to eat healthily. When I mean eat healthily, consume a lot of fruits and vegetables. I could remember then when I was working, I was still undergoing this, but then I was on medications and I was actually talking to a therapist. So I walked into a patient's room and the patient said, "Wow, you look like someone that has a lot of anxiety." He said, "I hope you take a lot of fruits and vegetables." I said, "Yes." So you eat healthily, take lots of fruits and vegetables, drink lots of water, and try as much as one can to reduce stress. Like engaging in yoga and meditation. Remember what yoga and meditation is just like focusing your mind on one thing, just one thing, picturing one thing, 1-3 things, diverting your attention kind of. That's still what they teach you in psychotherapy. Wow, what 3 things can I see? By the time you divert your attention to other things, the thing that is bringing on the worry and the anxiety with time, your brain will constantly be readjusting to being mindful and having a calm mind. So another one is talking with a mental health expert. Yes, because you have to talk to the specialists in that field so they can actually with the information you give them and with the history they will take from you, they should be able to know what type of anxiety disorder you are dealing with and how to help her, because the treatment plan for them is not going to be generalized because they don't really have, let me put it like that, the same causative agent. But in all, being having a calm mind, eating well, drinking lots of water, trying to reduce stress, and having good people around you that makes you happy is also another way. So thank you so much. If you enjoyed the video, if you enjoyed the lecture, do well to subscribe to our channel, like and share. Please try and give us a thumbs up so we can bring you more. So we are going to continue in the next episode with the rest of the disorders. Love you all. Thank you. I'll see you guys in the next one. Bye.